Let's be honest, if you're spending your days hunched over a desk, you probably know exactly what posture pain feels like, right? Hi there, and welcome to This Explainer. I'm here today representing the medical educators at Westminster Multispecialty Clinic right here in Dubai, Healthcare City. And today, we're bringing our clinical expertise straight to you to break down exactly why that pesky upper back pain happens, and more importantly, how we can actually fix it. Okay, let's take a quick look at the roadmap for today's explainer, guiding you from understanding the root cause to how we systematically resolve it. We'll be looking at the mid-afternoon desk ache, the anatomy of your desk posture, the Dubai lifestyle factor, warning signs that you need physiotherapy, and finally, our specific Westminster clinical approach. So, kicking things off with Section 1, the mid-afternoon desk ache. We really want to start by validating that very specific, creeping discomfort that so many of you experience right at your desks. You know the feeling. It usually sneaks up on you quietly. It's this tightness right between the shoulder blades that magically appears right around mid-afternoon. A dull, persistent ache that just kind of settles in after you've been staring at a screen for hours. And honestly, by the time most people even notice it, it's just become an accepted part of their daily grind. At Westminster Multispecialty Clinic, we literally hear patients tell us every day that they just try to stretch it out, maybe aggressively roll their shoulders, or just plain ignore it, hoping it'll magically disappear by tomorrow. Well, let me tell you, you are definitely not alone in this. A recent report from the College Times hit the nail on the head, noting that back and posture pain are among the most common complaints treated in office-based patients, entirely driven by incorrect sitting and long screen hours. And I can validate that. At Westminster Multispecialty Clinic, we see this exact pattern every single day in the UAE workforce. It's incredibly common, but hey, that absolutely doesn't mean you have to just live with it. Moving right along to Section 2, the anatomy of desk posture. Let's put on our medical detective hats for a second to look at your body's biomechanics and figure out the actual root cause here. So to really grasp the pain, we have to look at the structure. We're talking about the thoracic spine. That's the section of your spine running from the base of your neck down to your lower ribs. Now, this area is beautifully designed for a perfect blend of stability and moderate movement. It's supported by a whole network of muscles like your rhomboids and trapezius, which are essentially there to hold your shoulder blades stable so your arms can do their job. When everything is aligned, you feel great. But desk work, yeah, it completely wrecks this balance. What's fascinating, and a bit concerning, is that there's a highly predictable pattern of postural decay when you're glued to a screen. Step 1, your head drifts forward. And actually, fun fact here, for every inch your head moves forward, it adds roughly 10 pounds of extra strain to your neck and back. That's like hanging a bowling ball off your neck. Step 2, your upper back naturally rounds out to follow that heavy head. And then step 3, your shoulder blades spread apart, totally losing their correct positioning. Suddenly, your muscles are working massive overtime just fighting gravity. And this creates a really wild paradox within your own body. On one hand, you've got this constant low-level effort happening, which leaves those muscles incredibly tight and tender from working so relentlessly. But then on the flip side, there's a total lack of full-range use. Because they aren't moving naturally through their full range of motion, they get weak. So you're left with a shoulder area that is somehow simultaneously completely tense and totally unstable. Which brings us to a huge clinical reality. When the upper back stiffens up, your neck is forced to compensate. You see, upper back pain rarely just stays in the upper back. Because your thoracic spine connects directly to your cervical spine, your neck, these two regions are constantly influencing each other. It's like a chain. If one link stops moving properly, the link right next to it has to work double time to pick up the slack. And that compensation, it sets off a whole chain reaction. We're talking headaches and neck stiffness that might seem like totally separate issues, but they're very often just expressions of that underlying thoracic stiffness. Plus, that poor shoulder blade position changes the whole angle of your shoulder joint, which ends up straining your rotator cuff tendons over time. At Westminster Multi-Specialty Clinic, we frequently see patients coming in for shoulder pain, and it turns out they've had upper back tightness brewing for months beforehand. Leaving one area untreated almost always damages another. Okay, Section 3, the Dubai lifestyle factor. Let's explore why our specific environment here in the UAE seems to put this issue into overdrive for so many of our patients. There are a few unique aspects of professional life in Dubai that really compound these risks. First off, the working and commuting hours are famously long, which means a huge chunk of your waking hours are spent sitting down. Then, throw in the universal, freezing cold air conditioning we all know and love. It not only keeps us indoors and sedentary, but the cold physically makes your muscles tense up. And finally, we see this imbalanced gym culture.
A lot of professionals hit the gym for heavy bench pressing but completely skip their posterior chain workouts, which just loads up the upper back without giving it any structured recovery. Moving to Section 4, Warning Signs for Physiotherapy. So, the big question is, how do you know when it's time to finally stop ignoring the pain and come get professional help? Well, the truth is, not every ache needs a clinic visit. Normal discomfort is usually pretty mild. It tends to show up at the very end of the day, and it usually goes away with a quick stretch or a walk. But if your pain is there right from the minute you wake up, or if it's been nagging you consistently for over 2 to 3 weeks, or if it radiates down your arm, feels like a deep ache, or starts triggering headaches, that's when you need to come see us. When you're hitting those markers, the problem has become structural. It's a positional issue now, and it's simply not going to fix itself. And that leads perfectly into Section 5, our Westminster clinical approach. Let's dive right into how our physiotherapy team at Westminster Multispecialty Clinic actually goes about fixing this underlying mechanical mess.
It all starts by assessing the full picture. We absolutely don't just chase the symptoms. We want to look at the entire biomechanical chain. We're assessing exactly how your thoracic spine is moving, where those shoulder blades are resting, your neck alignment, and yes, we even review what your specific desk setup looks like. Like we've discussed, upper back problems are rarely just one isolated thing, so our treatment plan has to reflect that comprehensive reality.
From that initial assessment, we follow a very logical, clinical pathway to get you pain-free. Step 1 is hands-on joint mobilization to get those stiffened segments of your upper spine moving again. Next, we bring in targeted muscle release specifically for that overloaded tissue. After that, we introduce progressive stability exercises to rebuild your postural endurance so the pain doesn't just come right back. And finally, we give you workstation and postural guidance, because honestly, treating you in the clinic but ignoring where you spend 8 hours a day just doesn't produce lasting results. Oh, and we always address the neck right alongside the upper back to make sure the whole system is rehabilitated. So if there is one crucial takeaway I want you to remember from this explainer, it's this. A 2-month problem is so much easier to rehabilitate than a 2-year problem. When you catch upper back pain early, it's highly manageable. Your spine responds incredibly well to mobilization, and your muscles will respond beautifully to targeted strengthening. But if you wait years, that stiffness and weakness becomes deeply entrenched in your body, making it significantly harder and longer to fix. Which leaves us with one final, really critical question for you to chew on today. Is time compounding your pain? If that upper back tension has just become an unavoidable, expected part of your working day, please don't let it turn into a permanent, chronic condition. Catch it now. Our team at Westminster Multispecialty Clinic is always here, ready to help you get your posture and your comfort back on track. Thank you so much for joining me for this explainer today, and please take care of that spine.